First off, help us understand. We've heard from Pracheta what she spoke about what's happening in India, but in the Gambia, help us understand what happened here.
Thank you, and thanks for the opportunity. I mean, about now 3 months ago, there was this report of increasing number of cases and deaths, and due to some acute kidney injury here in the Gambia, especially in Banjul, but also from other regions of the country here. And when that happened, the national authorities, with the support of WHO and other partners, undertook, a thorough full investigation process for trying to understand the causes of the situation. And based on some of the information received from that tertiary hospital where most of the cases were admitted, we did realize that there were an issue probably, with some of the medicine which were took by some of these kids. So that's how we went, on the testing of these different drugs and medicine, sent those some of those samples in some of the laboratories here in Africa, but also in Europe, and then we came with this conclusion of this contamination through the ethylene glycol and de-ethylene glycol with some of these products. And since then, I think there have been some really timely action which has been conducted by the government of the Gambia, with the support of the WHO, about the recalling of all of these different products, from that manufacturer, and then obviously also to take many other action for improving the surveillance, the detection, and the treatment on some of these cases. But definitely, we know that these products are, quite very toxic and also can be very fatal. So it was quite very challenging, to save the life of some of the kids.
So,
That's what has
So,
happened.
doctor, one of the things that we're hearing is that there are fears that these syrups may have been sold in other countries as well. Are we looking at potentially having to mop up the syrups in multiple countries? And also, we just heard about thousands that have not been accounted for and haven't been recalled yet, that they're still out there. Just speak to us about what's being done.
Yeah, when we had that confirmation from our laboratory, from our reference laboratory, definitely a global alert was sent to all of the countries in the world, including here in Africa. And there've been some quite very active communication for really interacting with the medicine regulatory authorities, in all of the countries, to ask them to be more vigilant and to make a kind of surveillance of potential cases. And at the moment, we have not heard much about, any other cluster of deaths or maybe contamination. But we really working very hard for maintaining that vigilance and that surveillance by using some kind of, classic and non-classic channels, of communication. So this has been done, and here even in the Gambia, starting from here, we are continuing the investigation, trying to refine more our case definition for the identification of the cases. But at the meantime, also taking all of the different necessary steps, for improving the capacities of the health systems, like bringing, more people, but also more equipments, laboratory equipments, but at the meantime, also treatment equipments, and obviously the medicine, some kind of really well-certified medicine, for helping to save more lives here in the Gambia, but also in the other countries of the region.
Doctor, I would like to just ask you, when we talk about these syrups may have crossed their borders, are you speaking to other countries about what they can do to prevent what's happened in the Gambia?
Yeah, again, as I was saying, it's first of all, to increase the vigilance and the surveillance, of the clinical presentation that we have seen here in the Gambia, and we are documenting that a little bit more, and we are sharing that within, the communities of practice, both here in the sub-region, but outside also of the sub-region. So that's really a very important aspect. The other point is also definitely, to try to engage more the populations, more the communities, to limit, the consumptions of some of the drugs that they can, find in markets or maybe in other places where this has not to happen. So really limiting the self-medication and looking for appropriate care as much as possible. It's challenging, but those are really the elements that we need to take into consideration, and reinforcing all of the regulatory mechanism, for being sure that the medicine that we have in different offices, in different different pharmacies, are really good medicine, and I mean certified medicines. So it's a full process that we are starting now, and that we really need to continue, and to most of the countries here in Africa, and to be better prepared and be better able, to respond to such emergency.